Good afternoon, everyone, and welcome to today's edition of our Spotlight interview series. And what an incredible day this is. I'm very happy to be here today with Rae-Lewis Thornton, who had an incredible life of activism and public speaking, and has just published a new book that we're going to hear about. But I want to welcome you to the show, Rae, and thank you so much for doing this with us.
Thank you so much for having me. It is absolutely my pleasure to be here.
Well, it's a wonderful thing. We have the Essence magazine cover up here in the museum. It's actually not up right at the moment because we are in the middle of changing exhibits out about our media pieces that's on the wall behind me right now. But we always start out our Spotlight interview series with talking with people about what their earliest memory is of hearing about HIV/AIDS.
You know, in 82-ish, maybe, I had vaguely heard about this illness that were affecting white gay men. And then in the summer of 1983, I went to work at the time it was Operation Push, which is Reverend Jesse Jackson's organization. It's now Rainbow Push Coalition, and I was an intern, and we were sitting in meetings. You know, I talk about this in my memoir, how I was really shocked that Reverend Jackson actually ran the staff meetings. And at the end of each staff meeting, he would say, let's keep Keith in our prayers. And, you know, I heard it, you know. So one day I looked to Reverend Kreider, who was my immediate supervisor, and I said, "Who's Keith?" And he said, "Shh." You know, he didn't want to disrupt the meeting for it. And later he told me that Keith Barrow was the son of Reverend Willie Taplin Barrow, who at the time was vice president of Operation Push. And her son Keith was a famous R&B singer who was dying from AIDS. He literally had come home from New York. And you have to think about it in this context. The Center for Disease Control first documented cases were 81. So this was the summer of 83. He had come home from New York to die. And it changed at least how I began to see this disease a little differently. So I knew that it affected Black men as well as it affected white men. And, you know, I watched Operation Push and the political family there surround Reverend Barrow and her husband and just provide the most incredible support for her as she watched her only child die from a horrible death. And then I went to his funeral. It was my first AIDS funeral. And after his funeral, I left Chicago and went to work on Jesse. I was the Deputy National Youth Director for Reverend Jackson's presidential campaign. And so, you know, he talked about HIV on the campaign trail because, you know, he was the only presidential candidate talking about HIV on the campaign trail. And so, you know, I kind of got my indoctrination and understanding of this disease first vaguely through the press, but then up close and personal at the beginning of the pandemic with my exposure to Keith and, you know, Reverend Jackson challenging Bush. Ronald Reagan was president at the time. He hadn't mentioned AIDS out of his mouth. And And we say AIDS because we didn't even know what HIV was back then.
Right.
You know,
Yeah.
it didn't exist in our conceptualization. The only way to know that someone had HIV is if they were rushed in the hospital and they were dying from 1 or 2 or 3 or 5 of the AIDS-related complications. The terminology for HIV didn't come until 1984, 85. So yeah, that was my first. And you know, it was heartfelt, it was political, it was, you know, all of those things for me, because it affected, because I didn't know Keith, but it affected the people around me that I was getting to know, who were, you know, mentors to me. And then of course, when I was diagnosed with HIV in 87, my prayer was, Lord, don't ever let me get AIDS. You know, because still back then they weren't sure if everybody with HIV would transition to AIDS, because I understood that even in 1987, AIDS was a death sentence. So yeah, that was for me.
Yeah, that's really, you know, just this morning we had some visitors here in the museum, and they were mostly gay men that were in their 50s, and that had been, you know, around and aware of what was going on back then. But I think that's one of the things that we really get challenged with here at the museum, is just trying to help people to understand how little we knew. And so I really appreciate that about 1983 and what that must have looked like. And then having experience, what I think is kind of striking is that you were already making history in a different realm during the Reverend's presidential bid, and getting to work on that. So you were already sort of living in history with that. And even 1987 for a lot of people, you know, was fairly deep into things, but we still really, there wasn't a lot of understanding.
There wasn't. And I started out as a, college organizer, and Push, being at Operation Push, kind of clarified for me that, God had placed me, that social justice was supposed to be the work that I do. And, what some people don't know is I found out my HIV from donating blood. In fact, I organized the blood drive because there had been an Amtrak. And this is to kind of get an understanding of still where we were during that time. There had been an Amtrak accident in Northern Virginia. I was living in DC, working in politics. I think I was working for a Sane Freeze, a peace and disarmament organization at the time, as a national field director. And there had been an Amtrak accident in Northern Virginia. They were afraid. There had been blood shortages, and people were afraid. There were news reports on how people were afraid to donate blood because they thought somehow magically this virus was going to jump on a clean needle and get in their veins and give them HIV. And I thought, how absurd. I organized the blood drive and at my job, and what I thought was a thank you letter was a letter telling me that something was wrong with the blood I donated. So think about, I keep going back to put people in perspective. 1981 were the first documented cases for HIV. 1984 was when the Pasteur Institute in France discovered the HIV virus that caused AIDS. 1985 was when the U.S. Department of Public Health announced that Robert Gallo had discovered the HIV antibody that caused AIDS, and they rushed to patent and called it the HLTV2 or something like that. Yeah. Of course, the Pasteur Institute sued them because Americans had stolen the research or something like that. But they worked out the lawsuit and they shared the patent in the end. That particular HIV antibody test in 85 was specifically for HIV to test donated blood.
Right.
So in 87, we weren't even telling people to go get tested for HIV. They were afraid that all of these gay men were going to rush to get tested for HIV. And so it was just still a really ugly time. AZT had just been approved. Think about it that way. And they still were only giving it to people with AIDS. They didn't recommend a wider use of AZT until 89. And that was when I began. So I started on AZT. I have been through all of the first generation antiviral, antiretrovirals. And so they were burning people out of, kicking kids out of school. Ryan White was a symbol of hope and decency. You know, this little boy had been ostracized from his school. And I talk about this in the book, how I didn't ever get to know Ryan, but Jeannie, his mom, and I became friends. And, you know, in this little town in Indiana, people were saying that her son, who had contracted HIV through hemophilia, because she was a poor house cleaner.
Right.
You know, could you imagine? And that's really where we were in 87, 88. Jesse Jackson then became the first presidential candidate to actually mention on the Democratic floor HIV/AIDS in 88. So we have come, and I say this to say, we've come an enormous, we've come from AZT to over 40 HIV medications. What we haven't been able to conquer is stigma around this disease that's still very prevalent. That's one of the reasons why I continue to do what I do. And I chronicle in the book, I talk about how ashamed I was, how I didn't want anyone to know my HIV status. And I only told my HIV status when, you know, I thought I was dying and God had another plan. I started speaking and I ended up on the cover of Essence. But I think your museum is important to put this disease in perspective. I mean, in a different way than COVID, we didn't have the kind of political sizing that we do. It not wide stream, people understood it was a medical issue, but they were afraid of it because we didn't know so much about it. But then we did have people like Senator Helms, who, you know, passed a bill. He wanted to get us all locked up, you know, and so it was just a crazy, crazy time for HIV. Really.
Yeah, you're absolutely right. I mean, I think that's one of the really important things about these types of museums and having these conversations is because people don't realize what was done. One of the stories we have in the timeline is actually a story from 2009 about President Obama lifting the travel ban on people living with HIV. And people are surprised to hear that the United States would not accept anybody into the country. And that they did that probably around the same time that you're talking about, 87, 88, that they set that rule in place. And so just trying to remember all of that, I think, and really get in touch with what that feels like emotionally. You know, having that information. So I wanted to ask you about that, you know, so going from, how did you find it in yourself to, you know, I'm going to go ahead and put myself on the cover of a magazine.
Well, I didn't put me on the cover. Susan Fraser, editor-in-chief of Essence, put me on the cover.
Right.
But I didn't understand, what it was going to be. And I talk about this in the memoir after, you know, this 12-hour photo shoot in a studio in New York with some of the most beautiful gowns and makeup artists, that I looked out of the window in Times Square. We were staying in a hotel in Times Square, and I said, this is big.
Mhm.
I just didn't know how big it was. So when you follow my timeline, I believe I was infected in 1983, the same summer Keith Barrow died. And I do talk about, which is something I've never done, I do talk about it in the memoir, who I believe infected me, and I chronicle that course. But they were still telling people you may not die. No, they were telling everybody they was gonna die from AIDS. The life expectancy was 18 months. But they were telling people you may not get AIDS. So when I transitioned to AIDS, I had been told over and over and over again through media, you know, that you have 18 months to live, you're going to die. And so I systematically started disclosing my HIV status, telling people that, hey, look, I have this disease, and, you know, you need to know that, you know, and begin to prepare for my death. And don't be confused. I was clinically I'm a little tired because I've been promoting this book all week and doing press. I'm just about to lose. I had an event on Saturday, book signing, so I'm tired. So my thinking is a little slower. But my T-cell count started to drop drastically. When I was on the cover of Essence magazine, my T-cell count was 8. I mean, it was 86.
Wow.
And at one point after that, at the height of my speaking across the country, you know, when I was doing Nightline and Oprah and all of those shows, my T-cell count at one point was 8. And I had 3 bouts of pneumocystis carinii pneumonia. And we know there are medicines to prevent PCP. I had an incredible doctor, Marge Cohen, at Cook County Hospital. The problem is that I kept getting PCP, pneumocystis carinii pneumonia, while taking the medicines to prevent it. And so we thought, you know, I went from a size 12. At one point I was a size 0. So I really was on my way out of here. And we just kept fighting. So I only went public to let people know I was dying. And then someone who knew me in politics called me one day and said, will you come and speak at this high school? We got a call from a teacher who wanted somebody who wasn't gay, who wasn't an IV drug user. And, you know, he was like, we don't have anyone like that volunteers here. Would you go do it? And I spoke to the teacher, and on impulse, people would say, well, why does she want somebody that's not gay? Why does she want somebody, you know, because we go straight to, oh, they must be discriminating, or they must think that I'm a less than person because I'm gay, or I'm a less than. No, she said to me, look, I have had other AIDS activists here. My young people tune them out. They don't relate to them. I want someone that they can relate to. I went, the bell rang, kids came out, bell rang, more students came. And I noticed that some of the young people were still sitting, and I went to the teacher and she told me they were skipping class to hear me speak again. The same thing happened. I came back 2 days later and they were all in the hallways. And so her theory was correct. And I think that's what made Essence such a phenomenal. We told people that you could not look at a person and tell. And it became almost like a buzzword. Anyone can get HIV. You can't look at a person and tell. But when in fact, all the images of people that we had seen were white gay men, or people who looked like they were dying and half dying, and no one looked like me.
Right.
stories on people like me. And so I will never forget that day. I did my little HIV 101, how you get it, how you don't.
Mm-hmm.
And I stopped and I said, who can get HIV? And in unison, all the young people said, anybody? Can you look at a person and tell? No. And I said, okay, I want you to search your hearts. Tell me if you honestly think you'll be able to look at a person and tell. And one girl was like, we told you no. So I said, then no one's surprised that I have HIV, that I have AIDS. You got AIDS right now? Like, right now. Like, hell no, you too fine to have AIDS. This is where, like, the reactions were raw.
Uh-huh. Yeah.
And then that's when the education begins.
Uh-huh.
Because I can come back and say, you told me that you couldn't look at a person and tell. And then they'll say, well, my cousin or my uncle, or, you know, I saw someone on news, and they're sort of kind of, you know, like, if I thought you were gay, maybe. So then all of the stereotypes start coming out in their minds. So you cannot educate young people. You can't educate anybody when they're stuck on or limited or have limited access to the information out there. And, you know, I've taken some flack for it. I'm the diva with AIDS, but it works. You know, people bring me to speak in settings where they know the message will be received in a way that it hadn't been received before. And I'm a political organizer by profession.
Mm-hmm.
This is what I know. Mm-hmm. That when I worked on presidential campaigns as a Black woman, I was sent to Mississippi, I was sent to Alabama, Georgia, Florida, because I could organize those people better than the people I could organize in Iowa. And Tom and Kathy Ann went to Iowa and didn't come to Mississippi. Mm-hmm. And so, you know, kind of just say that to say that it was my methodology. Mm-hmm. But it worked. Right. And so being on the cover of Essence changed the discussion in the Black community. It changed the discussion specifically among Black women who at the time, HIV was the number one killer of Black women between the ages of 25 and 44 when I was on the cover. The other thing too is that we remember when you were talking about the travel ban, it was the same thing with IV drug use and the needle ban, you know, and for as progressive as Bill Clinton was on HIV AIDS, he didn't support needle exchange programs. Obama didn't either. Right. You know, they kept going back. One year they supported, the next year they didn't. And what we knew was that Black women disproportionately were impacted from HIV from IV drug use. And so we can't ignore the subliminal and the not so subliminal when it comes to women in the AIDS pandemic, and also people of color in the AIDS pandemic, and how we, you know, we were just left to fend for ourselves. Even the HIV studies, the MAC study started 10 years before the Women's Interagency study. And so I applaud you for bringing me on and for, you know, having this really honest conversation about, you know, how this narrative has shaped out. And, you know, yeah. I mean, I understand that gay men are still the #1 cases of HIV in the country. That has never changed. But
yeah, I'll tell you, you know, as an educator, I will say that I think one of the most difficult things for people to, I harp about this a lot, people don't understand both and very well. Right. They understand either or. You know, they want things to be either or. And so trying to expand and say, you know, look, you could be from anywhere, and there's a whole nother story to this that people don't even realize, in terms of all of the people that stood up and went out and did things about AIDS in the beginning that we don't even know their names, you know. And so
absolutely. And you know, my good friend Victoria No wrote The Woman on Women and AIDS, just kind of like the how women were even displaced as AIDS activists in a gender-based, because AIDS organizations were white gay men. And I think that we can learn from all of these lessons. And I think that's why that history is really, really important, because we're only, Andy, gonna get to zero when we all come together on this, period. That's it. Yeah. That's all. Yeah. You know, and I'm grateful for the place that I am in history, but I'm also grateful for the women in ACT UP who protest in front of Cosmopolitan when Cosmopolitan in '88 said that women who had normal vaginas couldn't get HIV.
Yeah. Isn't that incredible?
It's incredible.
Yeah.
That a magazine was telling women that they couldn't get HIV if their vaginas were normal, if they had stationary sex. And so everyone, is what I've learned in all the years, is that everybody has a place and a space to help further this disease along, you know, further the treatment and testing. And, you know, instead we're stuck in a vicious cycle.
No, and you know, and the thing that's so crazy is we have a hashtag here at the museum, it's not over yet, because I still encounter college educated people who say to me, well, isn't that over? And I just can't believe that they think that, but they really think that like it's something in the past. Even though, you know, here in South Florida, we're in the #1 region in the country for new diagnoses. But, you know, I've had the advantage of having several conversations with you leading up to this. And I can't believe how fast the time has gone. We're sort of toward the end of our time, but I want to do two things. I want people to hear about the book and how they can get your book. And the second thing is to hear about what you do for to recharge, and show us the cover, the beautiful cover of that book. That is wonderful. Unprotected. I love it. And it's
and no, I didn't steal Billy Porter's title. In fact, my book has been in the work for 15 years, and this has always been my title, period. So my book chronicles, so I do chronicle the historical journey that surrounds my HIV status, you know, what it looks like in the 80s and 90s, you know, what it was like to take all the first generational HIV medicines. But it doesn't start there. I start at childhood, and I trace, I show how unprotected and violated I was as a child, and how it shaped the trajectory of my life and led to HIV. You know, I lean very heavily on the ACEs research that connects childhood experience, adverse childhood experiences to poor health outcomes for adults. And we're talking about, you know, not HIV specific, but HIV, drug addiction, alcohol abuse, homelessness, obesity, but also heart disease, diabetes, irritable bowel syndrome, cancer. And so we've got to begin to bring this cycle kind of full circle, to begin to understand what happens as a child that leads us to HIV. And so that's where I've centered the work, the trauma that impacted my life, that created, for me, I'm an adult survivor of childhood sexual abuse. By the time I was 18, I thought if I could suck a man's dick and make him holler, he'll love me forever. And I found out the men don't even have to like you to get some head. So, and so I thought it was important to talk about, because people with HIV don't just get HIV. We had an entire life before HIV entered our journey. And and what we do know about the ACEs is that most people with HIV have a high ACEs, childhood score. The scores of 1 to 8, I have an 8, but we do know. And so that's what I do. I show how unprotected and violated I was as a child, and how the trauma shaped the trajectory of my life. And you'll see how God placed all these incredible angels in my way, on my path. But you'll also see that even my own missteps that just kind of, and not to blame me for my HIV status, because I don't work through that in therapy. It's about just showing what some of these things do to us as children that land. Viktor Frankl, I use this quote very often, says, an abnormal existence, living in a continuous abnormal existence becomes a normal way of life, And so, and I think that should be on the table for people with HIV, because we come to the table with so much more baggage than HIV that we have to unpack before we can even begin to just really deal with our own diagnosis and breathe. And so it's a lot of good nuggets. It's a lot of history. It's a great book. It reads like a novel, and you will want to get it. Unprotected, a memoir. And what do I do? What do I do? What do I do to find my center? I would be remiss if I didn't say this first, that living with HIV has been a journey for me. And I have gone through all the first generation of the medications. Right now, my viral load is undetectable. It took me a long time to get to undetectable viral load. And people often ask, how do I do this? I do this because I follow the rules. I take compliance is so important. You want to live with HIV, which you can. It's no longer a death sentence. You want to get in treatment, and you want to stay in treatment. You want to follow the rules. But then you've also got to carve out the other spaces for yourself. I'm in therapy. I don't care if I have to stay in therapy until I'm 99. I want to be healthy. I want that neutral space. I knit. I have a cute little puppy dog, Chloe Chanel.
Oh my gosh. Hello.
And she's laying in my lap being a good baby. She's so old.
I didn't realize we had a second guest. Yeah.
So I knit, and I'm an avid reader, which is interesting. You'll see in the memoir that I didn't read my first book until I was 13, because trauma had affected my ability to learn. So I read, I knit, and I've created a home for me, my own space, a place where I can just exhale. I can take off the makeup and, not be the glamorous, and just exhale, and I talk about it on social media. You can catch me on Twitter and Instagram at RAELT, Rae-LT. I have 2 Facebook pages. You can always talk to me. I'm very friendly. I may not answer you the same day, but I get to everybody. But I do carve out that space. It's walks with my dog. It's knitting, something wonderful, a scarf, a sweater, reading. I don't watch a lot of TV, but I do a lot of reading. And that's what I do. Because this is what I've learned, Andy. You only have one life to live. And so that each morning you wake up, you're still a part of God's earthly plan. Whether your God is whoever you believe in or whatever you believe in, on the premise that you are still a part of the earthly plan because you woke up. And so for me, to whom much is given, much is required, my prayer is every morning, God, how can I enrich the lives of others? What would you have of me today? Mm-hmm. And then I do service, and then I do something to where I can exhale. Mm-hmm. And it may be as simple as, again, picking up the knit needles, and that's it. These last couple of weeks have been pretty hectic because the book is out. We've done really, really well. We've been trying to beat out, Robert Kennedy has a book on Dr. Fauci, some kind of conspiracy theory. So all of his books are like 1 and 2. There's a book about the plague, it's 3. And I've been floating between 4 and 8 in AIDS. And it's like, I even thought about that. I was like, why can't a good doggone book like mine beat out fascism and conspiracy theory books that are in the AIDS category, still purporting misinformation that is destructive to people and destructive to and puts us, it situates us still in the pandemic as opposed to getting to a better place where we can really get to that cure, get to a prevention vaccine, get to zero, get everybody to undetectable so that we don't transmit virus to the people that we love and care about. That's kind of where I'm at. It's half and half, always working, always thinking, but I'm also carve out time for myself.
Well, I really love the creativity. I think that's one of the things that I hear coming through in that definitely is using your creative outlets.
Absolutely.
To just
let me say this. I want to at some point open up a wellness center for crafting, using crafting, because it's been shown that knitting, the repetition of knitting, will reduce your blood pressure equivalent to blood pressure medicine. So working with my hands have been very, very therapeutic. I bead bracelets too. But whether you crochet, you bead, you paint, whatever your craft is, but working with your hands, the repetition of working with your hands is very therapeutic.
No, that's really wonderful. I hate to have to wrap up. I have to say, through this talk with you today, the other thing that I come away with in your story is this overarching theme of resilience. When you talk about the ACEs and you talk about the scores and people living with HIV with these experiences, and that's been to me one of the best things about the museum. One of the things we want to really try to do for people is to show them the ways that people have overcome stigma and the ways that people have been so resilient. So a lot of times when I talk to somebody who hasn't been here, they'll and tell them what I do and where I work, and they're like, well, that must be really depressing to tell all of those things and remind people of all that. And it's, yeah, that's a part of the story. We never want to forget all the struggles that we had, but there's so many things that show us the ways that people can rise above something and the ways that people can bounce back.
Yes.
And really forge new paths.
Yes.
It's all these things that we never think about, universal precautions. You and I talked about HIPAA. AIDS didn't cause HIPAA, but without AIDS, I don't think that people really would have understood the issues.
Right, because anybody, any nurse, anyone sitting in the office could just, I talk about that in my book and my fear of that. Someone knowing somebody say, oh my God, that, and HIPAA didn't come what to 92,
Mhm.
94, or was it
Yeah,
98? It was
it
later
was,
in the 90s.
yeah, it was the
But just
90s.
think about sitting in the doctor's office wondering if a clerk is going to see your name
Right,
written on a paper and your status, and then go tell somebody that they know,
right.
you know? And it was just, it's a horrible time. It was a horrible time for us. And I think the museum is powerful in that we have to know our history to know where we're going,
Right.
you know, and we have to learn from our mistakes in the past. I mean, this disease is not over. And I say all the time, what happened? Why are young gay men getting HIV record numbers now? Like,
Mhm.
what didn't we do? What's missing here? And so, you know, it's still a lot of work to do that needs to be done, but we have to understand where we came from. We have to understand that had it not been for a Larry Kramer and the Women's Caucus and ACT UP and all of these incredible people to do, you know, what they did, we wouldn't be here.
Right.
There were no books on AIDS. All we had were the gay men's health crisis, and then we had the AIDS treatment news that came out of California. Then HIV, T-Pan came along, was in Chicago. So we had these regional ones, but there was no book to read on HIV. And the band played came on in 87, 88. But that was just kind of documenting where we've come from.
Hmm.
So you know, we live with this disease by the grace of God and a lot of fight. And I wasn't the only one that persevered. You
Yeah.
know, we just kept fighting. And
But
that's why the ACE Museum is important.
thank you. And thank you for that. You know, this has been a great discussion. For everybody's information, June is one of the things that we celebrate in June is the awareness of long-term survivors. And Rae, you are a gorgeous example of that in every
Thank
sense of the
you.
word.
All I
So,
can say, but the grace of God and a lot of work. You know, I just need to say this, and then I'm going to let you go, honestly. I was talking to my doctor, March Cohen, right, like about 3 weeks ago. And I said, you know what was so incredible about you is that you never told me that I was dying. And she said to me, but you were, and I didn't want you to. And so I survived because when I could no longer fight, I had someone who would fight for me. And she fought for me, and I'm still here.
yeah. Thank you. And we'll go ahead and close out for today. And hopefully this is a beginning and not an ending. We'll see more of you.
Absolutely.
Thank you for everything. And we'll
Thank
stop there.
you.
Thanks.
Bye-bye.
Bye.